Welcome everyone to our 6th Healthcare Data Matters webinar, where healthcare leaders and innovators join in conversation to set a new standard of patient-centered and data-driven care. Today's topic discusses accelerating medical research and AI through collaboration and focuses on Rice University's Data to Knowledge Lab. Before we meet our guest, Dr. Genevera Allen, who's the founder and faculty director of the lab, let's do a little housekeeping. First off, my name is Bruce Hall, and it's my privilege to be your host for this webinar and the related podcast series. My hair may be a little longer than in the picture. That's due to COVID, but I'll be getting a haircut soon, I promise. Let's start by covering a few disclosures. First off, funding for the Healthcare Data Matters Forum is supported in part by Medical Informatics Corp and Intel. Presenters' opinions and viewpoints are their own, and we do not pay speakers or offer any exchange for product endorsements. You can see other disclosures on this slide. Now it's my extreme pleasure to introduce our guest today, Dr. Genevera Allen. Dr. Allen is the founder and faculty director of the Transforming Data to Knowledge Lab, or D2K Lab, at Rice University, where she's also an associate professor of electrical and computer engineering, statistics, and computer science. She's also an investigator at the Jan and Dan Duncan Neurological Research Institute at Texas Children's Hospital and Baylor College of Medicine. Dr. Allen will be discussing how and why she created the D2K Lab at Rice to foster collaboration and how it's directly impacting the acceleration of medical research and artificial intelligence. She'll provide information about the program, what industries it serves, healthcare projects that have been supported over the past few years, and answer questions on how you can get involved with the D2K Lab yourself. How are you doing today, Genevera?
I'm doing well. Thanks very much for having me.
Well, it's so great to have you with us. Thanks so much for taking the time. I'm really interested to hear about the lab. Our format today is first, I'll ask you some questions to give you a chance to present the lab and its work. And in the meantime, our audience members can type any questions they may have about the lab or its work in the Q&A tab as shown here on this slide. And at the end of your talk, we'll answer as many questions as we have time for at the end of the session. Sound good? All right, let's dive right in. First off, can you tell us a little bit about the D2K Lab, the Data to Knowledge program? What is it and why did you start it?
Sure. So the D2K Lab is what we informally call it. Officially, it's the Center for Transforming Data to Knowledge at Rice University. And this is a university center that is focused on innovative and interdisciplinary data science education. We do academics and we have courses that we offer. I'm going to tell you a little bit more about some of those, and lots of programs and events for students focused on engagement, enrichment, and excellence in data science. What we do that's unique is we actually provide opportunities for our students in courses to partner with some of our affiliates from, say, the Texas Medical Center, which is right across the street from Rice University and what I'm talking about today, as well as government and nonprofits, community organizations, as well as companies and so forth. So we provide students opportunities to get their hands dirty working on real world data science problems. And in the process, they're learning all about real kind of data science, getting their hands dirty and providing solutions for our partners and prototyping real data science, machine learning, and artificial intelligence solutions.
I know you have a piece specifically on D2K Capstone. Can you tell us a little bit about that?
Yeah, so one of our big programs that we run is an innovative data science and machine learning capstone program. In the capstone program, we have students, teams of 4 to 6 students work on a project that's sponsored by an external client. Again, these could be Texas Medical Center clinicians or healthcare researchers sponsoring a group. It could be a company from energy or finance industry sponsoring a team, or it could be community organizations. We've worked with a number of government agencies as well. And they sponsor a team of students. And what's unique about the D2K Capstone at Rice is this isn't a capstone for just one particular degree program, but we actually have students from across Rice University work together on teams. So we have data science students, we have students from all sorts of computational disciplines, even students from social sciences or natural sciences working on teams together Furthermore, we actually have seniors in undergrad, professional master students, and even PhD students working together and coming together to form teams. What we've found is that interdisciplinary research really matters and pays off, and bringing students from different backgrounds together with sponsor mentors that help them understand the domain area really leads to fantastic results from our students.
You know, I heard you mention a few vertical industries. You mentioned healthcare, you mentioned finance, I think you mentioned energy. Can you take us through all the industries that you serve and what other industries have benefited from the program besides the three I mentioned?
Sure. So we've worked with quite a few. So far, the D2K Lab and our capstone program in particular has been in operation for 3 years now. And we've done over 50 capstone projects with external sponsors in those 3 years. So we're very excited about that. The program is off and really growing. We're in Houston, so a number of our partners have been from the energy industry, but we've also worked with technology companies, finance companies. We've worked quite a bit with community partners, different agencies in the city of Houston and Harris County in the Houston area. Also a longstanding collaboration with the Houston Fire Department. And of course, lots of collaborations in healthcare and biomedicine, in part due to our proximity across the street from the Texas Medical Center.
Well, it really sounds like you're inviting industry into the world of academia to exploit this rapidly evolving space of AI and machine learning. Tell us a little bit more about that impact. Any key highlights that you'd like to share, and where can people go to learn more about some of the projects that are underway there?
Sure, absolutely. So our projects and kind of the impact they have, I like to explain to people that, well, Rice students are fantastic. They're super enthusiastic about data science. They want to make a difference using the skills that they've learned at Rice. And so our students are fantastic at prototyping solutions. I explain to people that in a semester or a year, you might not have a full production model of an AI or ML system, but if you need a creative, almost R&D solution, they're really good at prototyping those. So some of the impacts we've had are, we've worked with some technology companies that our student teams have prototyped an ML solution that was later actually put into production. Of course, I can't tell you the names of those because we have, NDAs. We have worked with the Houston Fire Department to help understand fleet allocation and resources, and to project out the impact of hiring more ambulances in the Houston Fire Department system that they use to actually go to the city and ask for more appropriations to hire those ambulances. So we provided kind of a data-driven solution and decision-making process for them. And of course, we've done a lot in healthcare, and I believe I'm excited to tell you a little bit more about some of those projects as well.
Well, that's a great segue, because this obviously is Healthcare Data Matters, very focused on healthcare and how data feeds AI and benefiting those outcomes. So tell us a little bit about your healthcare focus. What are some healthcare specific projects you're working on? And is there anything that stands out to you among them?
Yeah, so a lot of our healthcare projects have been done in collaboration with clinicians and researchers at Texas Children's Hospital, UT Health, Baylor College of Medicine, and even, again, some healthcare and kind of public service projects for the city of Houston. So some of the projects, here's just kind of a subset of some of the projects right here. A really interesting project was actually using NLP, or natural language processing models, to develop a chatbot to help monitor patients with COVID systems. And currently we have an extension of some of the same students are working on adapting that chatbot they developed for COVID to help assess stroke risk. So kind of advancing telemedicine through smart apps using natural language processing. So these are some of the types of things that our students are doing. And we've had a lot of success working particularly with collaborations in cardiology. And one of the projects that's mentioned here is detecting cardiac instabilities that are predictive of cardiac arrest. So imagine, for example, if you could say an hour before, if you could predict someone's going to have a cardiac event an hour before, instead of waiting until you actually have symptoms before going to the hospital. This would dramatically save lives. And the idea is maybe we can actually do that from some of the data that's available using machine learning. And so this team has been very successful and is working on these types of projects as well.
Well, really interesting. I want to ask you kind of a side question, if you don't mind, on this slide and some of the medical stuff you're doing. Where are you getting your data? Are people approaching you and giving you scrub data? Because obviously there's issues of confidentiality and all that. Tell me about where your data comes from.
So that's a great question. We have two mechanisms that we work with people on sharing data. The first one is if data is protected data, HIPAA data, or if data is, if we're working with companies, if there's some type of confidential data, we actually have a system in place, a sponsored research agreement that allows people to partner with us, and they still house the data in their secure systems, and they just give the Rice students and the faculty mentors access to the data on a secure system. So none of the data is transferred to Rice. We have all the sponsored research agreements in place already that protect the data and the system, and also protect, if it's a company, protect their IP, intellectual property, which is clearly very important.
Beautiful. Sorry.
Oh, sorry.
No, so you just apply your AI algorithms to the data in place, it sounds like. That's great.
That's right. So, I explain it to people. It's kind of like, imagine if you went and hired an intern, you would give them access to the data through your system. But instead of hiring one intern, you get 4 to 6 fantastic Rice students working on your problem for a semester. So that's one mechanism. The other mechanism is if a data set is declared as not protected, anonymized appropriately, not confidential, the data can be shared directly with Rice, and the students can work on it on Rice computing resources and systems. So we provide both mechanisms, and this usually works with most of our partners.
Well, thanks so much for all that data. For all that information. It's so illuminating to understand where the AI algorithms get their data, what you're using for data lakes, things like that. There was one healthcare project that you had that really caught kind of our attention here, and it's on JET, or junctional ectopic tachycardia, which is a webinar we actually did with Dr. Padak Jain, our third webinar in this series last fall. We talked to Dr. Jain about this, and you did a project on JET. Can you tell us about that?
Yeah, so we had a student team working on developing a system to detect JET, or when these arrhythmias were occurring. And it's particularly challenging in pediatric cardiology patients because the data is quite noisy. The heartbeats are a little bit less stable in this type of data. So it's hard to understand whether an actual arrhythmia is occurring or this is normal kind of fluctuations in the ECG channels that are being recorded. So this project, we had a team of students working on this project actually for about 1.5 years, and some students continued on it the whole time. This is a research project. Some students joined, so a total of around 12 students worked on this project, and they did a fantastic job. Several of them, I should mention, are publishing. So I believe they've submitted 3 research papers based on the results in collaboration with cardiologists from Texas Children's Hospital. And what was unique about this project was that most arrhythmia detection systems that are used are based solely on ECG data, or electrocardiogram data. And the challenge with that is, what if some of those channels become corrupted? Then suddenly you can't use those models, and those models are not particularly predictive. But in clinical settings, they're actually recording a lot more data than just ECG. For example, there might be central venous pressure, AVP data, other types of data. And so the idea was can you integrate all of this data and build a more robust and reliable predictive system for arrhythmia detection than a model that just relies on ECG alone? And what they discovered was yes, actually you can. Using these additional data sources, you can get better detection than just ECG alone, but particularly if any one data source becomes corrupted for any reason, there's reliable information in the other data sources that can still sound, an alert if an arrhythmia is occurring so that clinicians can intervene. So in addition to this, our students are working to create dashboards for cardiologists to actually utilize these tools and kind of be able to visualize and inspect their patient systems to understand better what to look for to detect arrhythmias. So our students are doing lots of aspects of this, and this is kind of one example project of the types of collaborations we have in healthcare.
And again, the instrumentation and capture and preservation of that data over time makes that kind of multi-data analysis possible, right?
Yes. I mean, I always tell people, the better data you have, the better machine learning is going to do. If you feed machine learning models garbage data, there's really not much they can do. So it is important to get to collect lots of data. And that is happening now across lots of clinical and biomedical settings. And especially this idea of collecting multimodal or multiple channels of data is really, I think, important and a new kind of cutting edge research direction in the healthcare industry. This happens to be, now we're talking about D2K Lab and the students here today, but this happens to be my area of research as well. I do a lot of data integration. I'm a machine learning researcher and work in this area as well. So I do think this is the cutting edge in healthcare research.
Well, I'd have to agree. And what a win-win you've created for both students to get access to this real world type data and these problems, and industry, not just healthcare, but to come in and take advantage of the horsepower of the students and the students available to work on this, not to mention the cutting edge AI and machine learning that you're doing. So congratulations. It's just an amazing lab that you've created and some wonderful work you're doing. How would those outside of the Rice community, perhaps another company or industry that would want to engage with you, how do they best engage with the D2K Lab?
Sure. So first of all, you can find out more information about the D2K Lab and the impact and the type of projects we've done at d2k.rice.edu. So very simple to find us. You can also email us, d2k@rice.edu. But the other thing is that we have an affiliate program that allows partner organizations to kind of join a membership program for companies and other partners that are interested in working with us. And as part of this, we of course work to set up capstone projects and work on these, but we also have a lot of other things going on in the D2K Lab, including we have lots of events and programs for students. We have competitions like the Rice Datathon and Hack Rice. And we love to partner with people to give them real world data science challenges for their weekend long, fast paced competitions. And it's great to have real world data sets for that. And so we provide partnership opportunities to join for those things as well as other, especially when working with companies. Recruiting events are always popular. So we do have an affiliate membership model. And again, you can learn a lot more about that from our website.
You know, you sound like a kid in a candy store talking about this lab. It's really amazing to see your energy behind it and all the great work that you're doing. So congratulations again. Genevera, we at this point, I think we've had some questions come in. I wonder if our VP of Research at MIC could come in. Raj Patel, how you doing there, Raj?
Hi, Bruce. I'm doing okay. Can you hear me?
Yes, I can. You want to take us through some questions for Genevera?
Yeah, for sure. So a couple of questions have come in through the chat. If you have some, please follow the instructions on the slide that you see on the screen, and I'll present them as they come up. The first question that has come up, can you talk a bit more about the COVID chatbot?
Oh, the COVID chatbot. Yeah, so I mentioned that briefly. So what the team was doing there was developing a system. The idea was that it's very hard, especially at the beginning of COVID. Nobody wanted to go out of their house, let alone go to a doctor or an emergency room. But doctors are a little bit, they're switching to telemedicine, but the systems are a little bit slow. And the idea was hey, maybe there could be an app that would help monitor symptoms of COVID and alert doctors if anything was going on. And now this app, of course, was not FDA approved. We developed a prototype. I mean, it takes a long time to actually get it up and running, but the students actually did use natural language processing models, which are basically developed kind of predictive responses. So you can, type in a question and it would predict a response. And the app was set up specifically so that it would ping you at various times of the day, ask you about your symptoms, and then record the responses. And so it would say, well, you had a headache yesterday. Is your headache better or worse than yesterday? And record these kind of trajectories. And from that, you can kind of see, okay, is the patient improving? Is it going downhill? Do we need to alert medical professionals to intervene? And so the idea of this chatbot, I think, is really interesting. And the students developed a lot of natural language processing models to get the chatbot to work. What they did there are some models out there in natural language processing to kind of general chatbot conversational things. When I say chatbot, imagine you're talking to like Alexa or Siri or something. I mean, that's what a chatbot is, but imagine you do this for healthcare. And so there's a lot of existing natural language processing models for chatbots, but they're not specifically focused on medical problems and not specifically focused on COVID. And so one particular thing that the students did was there's a huge corpus of papers now. I mean, there was like explosive research on COVID that happened over the spring and summer. And so what they did was they mined the medical literature. They used text mining techniques to uncover from all the medical literature on COVID they took some of the existing chatbot models that were out there and said, we want to retrain you to better respond to medical things. And they seeded that kind of pre-training using the medical literature, the existing medical literature on COVID. And so this is kind of an exciting area and something that the students are now not working on this COVID chatbot anymore, but some of the same students are continuing to develop a chatbot for other diseases using the same type of kind of model, mining the medical literature, getting the best information, and using this to develop a smart app that can talk to you and record your symptoms in real time.
I like that. Yeah, limiting the scope specifically to the language that's used for the conditions that you're trying to monitor, right?
That's right.
Very cool. A couple more questions. What are the roles and responsibilities of the D2K instructor in facilitating the capstone projects with student teams?
Sure. So the D2K Lab is set up as we have several faculty members that are instructors in any given semester or year for the capstone. And the idea is that data science and machine learning is a big area. It's not, there's a lot of techniques out there. And so we get faculty members with a diversity from different disciplines and a diversity of expertises that can help mentor the teams from kind of different perspectives. So we do have a RICE, what we do is RICE provides a faculty mentor for each team. And then we ask the sponsors that we're working with, our external partners, to provide a sponsor mentor. And the sponsor mentor should be an expert in the domain area and know specifically a lot about the data that was collected and answer any questions on that. And we found that model works really, really well because data science is interdisciplinary. You can't have just people with a data science background and expect to produce anything relevant without domain experts. So that model of having a domain expert mentor and a technical mentor that can help on the data science side is really critical. And that's the model that we use.
Yeah, and that fits too generally, right? Collaboration is the name of the game when you get out to solve real world problems.
Absolutely.
Can you talk a little bit about assessing the data quality, especially for healthcare? So healthcare data, right, before starting a project. Are there any specific criteria that's established, or do you have a process for that?
Yeah, so we do have, the way this works is we actually start setting up and developing these projects well before the semester starts. So we usually have a call for proposals that goes out about 4 months before the beginning of the semester to set up these capstone projects. We do this for a number of reasons. Number one, sometimes the project proposals come in and we look at them and we're like, this isn't quite the best setup for this project, but maybe if we talk with you, we can figure out how to set this up better to make sure that it's a great educational value for the students and our partners are getting something out of this. So, and the other thing we do is work with them to set up what type of data is needed for this project and make sure the data is in place. So, and I should say, sorry, there's one more thing, getting all those sponsored research agreements and all the legal stuff taken care of and signed before the semester starts so that we can actually work on the project. Our goal is to have the data there set up and ready to go so the students can start on day 1 of the semester, which actually takes quite a bit of work before the semester to set these up. Now, you might say, oh my goodness, that sounds like so much work for just a semester-long project, but we actually do these, we seek to work with people not just for 1 semester, but kind of long-term engagements. For example, we've been working with the Houston Fire Department. I think we're going on our 6th semester in a row now, so we're really looking for long-term engagements where kind of once we have a process for understanding, okay, what type of data you have, what data do the students need for this process, we can then work with people a lot better to kind of get things set up semester to semester. And we also have student teams work on extension projects sometimes. If they had a really good idea, but just need more time to make it up, we will actually have teams work, multiple semesters, because not everything can actually be solved in a semester time frame, of course. And so we have them work for longer periods of time on some of these projects.
Yeah, and I feel like it's really important to bring data science out to the community, right? Beyond the hedges or, the bubble, so to speak. And so having those long-term projects or multiple semester projects goes a long way in developing those relationships, I think.
Sure. Yeah.
Yeah. All right. I think we have one more question. We have a couple more minutes, so bring them in while you can. But to bring it back, though, into academia, can you talk a little bit more about publishing? Or you mentioned that some of these projects resulted in some peer review publications. Can you talk a little bit about that?
Yeah, so we certainly have the arrhythmia detection project that I mentioned. The student teams from that did submit, I think, 3 papers that are at various stages of review. Unfortunately, by the time D2K Lab is only 3 years old, and by the time the students work to submit the papers, and publishing often takes a long time. We don't have any that I can talk about just yet. I do know of several in the submission stage, however, that are really exciting. So we do think this is a great model for jump-starting collaborations. It's a great model for people that are looking to get preliminary results to submit a grant, for example. Our Rice students are really creative. They can get great preliminary results that can potentially lead to kind of grant proposals for long-term funding and collaborations. Part of what we want to do is also connect people who have data science challenges to our Rice students, but also directly to our faculty members who might be kind of the natural partners on a long-term collaboration, and of course can involve students in the process as well.
Very cool, very cool. And again, with continuing on with this work, branching out, right, blooming these ideas into ongoing projects. Very, very cool. We are unfortunately out of time for questions, but if you did ask a question in the chat that did not get answered, we will respond to them in an email or we will get back to you. So please don't worry, but we are out of time for right now. So I'd like to turn it back over to Bruce. Bruce?
Thanks so much, Raj. Genevera, before we sign off, could you share the contact info again on how folks can engage with D2K Lab?
Absolutely. So check out our website, d2k.rice.edu, and you can always contact us at d2k@rice.edu. So very simple. We'd love to kind of hear from anybody that is interested in potential partnerships or just want to understand some of the types of projects that we've done.
Perfect. And thanks again for sharing all about D2K Lab and all your great work, and your enthusiasm and energy behind it is really inspiring. So thank you so much, Genevera.
Well, thank you very much for having me. It's been fun.
Okay.
Thank you.
All right. To the audience, we'll make Dr. Allen's presentation, a replay of this webinar, and an audio podcast version available on healthcaredatamatters.com. While you're there, you can also check out our previous webinars, such as Dr. Jane's webinar on JET, and join the conversation on our associated media channels. You'll be receiving a short survey after today's session, and we will also be in touch with information on our next Healthcare Data Matters webinar. We're running these about monthly now, so check back in and we'll have another one for you next month. Thanks again, everyone, for joining us today. Here at Healthcare Data Matters, we are grateful to have the opportunity to advance a new standard of patient-centered and data-driven care. Take care, everyone. Have a good afternoon.